Well, hello and welcome back. This is the second part of the endocrine system lecture, and we're going to start with the adrenal glands on this particular lecture. As you can see in this graphic here, the adrenal glands are located right here above the kidneys. Okay, so you have two of them, one on the right side, one on the left side. These are the kidneys down here, so they're right above the kidneys. You can see that they have a nice blood supply that goes to them, and they have veins that drain the blood from them. And if you were to cut them in a section, you would find that they have essentially an outer portion and an inner portion. The outer portion is called the cortex, and the inner portion is going to be called the medulla. And this is just a graphic showing you that. So on the outside surface there is a capsule, a material that covers the organ and our gland and makes it separate from the rest of the body. So here we have the cortex. So you can see this little section right here is the cortex, and the adrenal medulla would be located in this central portion of the section of the adrenal gland. Histologically, you can see there are different zones or different regions of the pituitary gland. You can see that it is divided into the zona glomerulosa, the zona fasciculata, and the zona reticularis. So if I take a look over here, you can see the capsule histologically, that outer layer that makes the gland separate from the rest of the body. You can see the zona glomerulosa. So this zone right here is the zona glomerulosa. And this is going to secrete some hormones called mineralocorticoids. Specifically, the one we'll talk about will be aldosterone. You can see the zona fasciculata is this zone right here. So this zone right here. And this is going to secrete things we call glucocorticoids, mainly the hormone called cortisol. The zona reticularis is this little zone right in here. And it's going to be secreting what we call the androgens. These are going to be hormones that will have an effect, a little different effect in males and females, but we'll talk about those in just a second. And then the adrenal medulla is all the rest of this inner material here. And they have chromaffin cells, and these chromaffin cells are going to release epinephrine and norepinephrine. This is going to be under the stimulation of the sympathetic nervous system that they release these particular products into the bloodstream. So the zona glomerulosa secretes the hormones called mineralocorticoids. These are used to regulate mineral homeostasis. The zona fasciculata is going to secrete hormones called glucocorticoids that will affect glucose homeostasis. And then the zona reticularis secretes androgens. These are hormones that have masculinizing effects on the human body. Aldosterone is going to be the major mineralocorticoid that I'll talk about, and it's secreted by that first layer of the adrenal gland. It helps to regulate sodium and potassium homeostasis. There is a system called the renin-angiotensin-aldosterone pathway that helps to control the secretion of aldosterone. I'll just talk about a little part of this pathway in just a second, and then talk about the second part of it in another time period. So this graphic shows you the adrenal gland, and this is the renin-angiotensin section over here, and I want to talk about that in a minute when I do the kidneys. But there will be a hormone that will increase the secretion of the adrenal cortex product called aldosterone, which comes from the renin-angiotensin system over here. But again, this portion over here I'll talk about when I do the kidney later on in this this lecture. So what the aldosterone does is in the kidneys it increases the sodium and water reabsorption. So you don't put that into your urine, but you reabsorb it and put it back into the bloodstream. It also increases the secretion of potassium and hydrogen ions into the urine. So this aldosterone is really important at homeostasis of sodium, and we'll talk about how it's controlled a little bit more when we talk about this part over here. So glucocorticoids include cortisol, cortisone, and corticosterone. And these particular hormones are involved in a lot of things. They're involved in protein breakdown, so they break down proteins and release amino acids to the bloodstream. They're involved in glucose and glycogen formation, so there is a glucose sparing effect, so it conserves or stores glucose. It has an effect that does that. Lipolysis, which is the breakdown of fatty acids into and put into the bloodstream from fat sources, occurs because of the glucocorticoids. It aids you in resisting stress. It protects you from stress. It is anti-inflammatory, so it has the ability to suppress your immune system, which can decrease things like swelling and things of that nature. So these are the glucocorticoids, and they have those particular functions. Now, so these glucocorticoids, you can see there might be a stimulus that will cause their secretion to occur. So how this works is whatever the stress is, the stimulus is, it will cause the neurosecretory cells in the hypothalamus to release corticotropic releasing hormone. This corticotropic releasing hormone will cause the release of adrenocorticotropic hormone. This will go down to the zona fasciculata in the adrenal cortex, and it will cause the release of glucocorticoids in the bloodstream. When the glucocorticoids have reestablished the balance, then it basically goes back in a negative feedback loop and will stop the secretion of the corticotropic releasing hormone and thus stop its production. So it is controlled in a negative feedback loop. So the androgens that there are androgens, different androgens that are secreted by the adrenal cortex. The main one is called dehydroepiandrosterone, and we know it as DHEA. And in males, after puberty, this hormone, the major androgen circulating in male bodies is testosterone, and it's secreted in such a large effect that DHEA has virtually no effect on an adult male body. In females, however, DHEA and other adrenal androgens are going to promote several different kinds of things. They're going to promote libido in females, which is sex drive in females. And they're also going to be converted into estrogens. So in females who stop producing estrogen from their ovaries, the estrogens that are predominantly made come from the conversion of adrenal androgens into those estrogens, so that the female has some estrogen circulating in the bloodstream. So the adrenal medulla is going to be stimulated by the sympathetic neurons of the autonomic nervous system. So sympathetic stimulation of the medulla is going to cause the secretion of epinephrine and norepinephrine. These chromaffin cells, are going to secrete epinephrine, and it also is known as adrenaline, and then norepinephrine, which is also known as noradrenaline. Both of these are involved in the fight or flight response, so it prepares you to fight or defend yourself in a stressful situation or to run away. And this is just a graphic showing you what controls the secretion and then what the actions are. You may want to take a look at that. So there are problems with the adrenal gland. Sometimes you can have a destruction of the adrenal cortex. This causes Addison's disease. This causes a loss of glucocorticoids and aldosterone, so the mineralocorticoid aldosterone. So these are some of the things that you might see: hyperpigmentation, low blood pressure, weakness, weight loss, nausea, vomiting, constipation. It could have little white patches on your skin, vitiligo. You can have all kinds of things like fever, fainting, which is syncope, convulsions, hypoglycemia, hyponatremia, natremia is where you have too little sodium in your bloodstream, severe vomiting, and diarrhea. We believe that President Kennedy had Addison's disease. He actually was probably a very sick president. And if you look at some of his skin, you know, a lot of people thought he was suntanned, but it was probably hyperpigmentation from the consequences of Addison's disease. Another problem with the adrenal gland can be caused by the excessive secretion of glucocorticoids in what we call Cushing syndrome. In Cushing syndrome, this would be a picture of a male with the condition, so you can kind of see some of the physical symptoms you might see. But moon face, dark facial hair in women, a buffalo hump in the back, osteoporosis, cardiac hypertrophy or the enlarging of the heart, obesity. So from the growing of the stomach, you might have striae, which is scar tissue from the increasing size of the abdomen. Amenorrhea, which is the cessation of the menstrual cycle in females. Skin ulcers, poor wound healing, muscle wasting in the extremities. So this is not a very good condition to have. All right, well, moving on to another endocrine organ, we move on to the pancreas. The pancreas is really important. It's located or tucked in underneath the stomach, or right underneath the stomach, and right in the curve of the first part of the small intestine. The pancreas has different functions other than endocrine functions. It has exocrine functions, so it makes a lot of our digestive enzymes, and it produces an alkaline fluid. So these digestive fluids and alkaline fluids are put into this pancreatic duct, and they're taken to and dumped into the small intestine so they can mix with food and help to digest our food. So the stomach located up here, the stomach is going to dump a lot of acid into the small intestine, and the alkaline fluid, which is a base fluid, will help to neutralize the acid coming from the stomach. The endocrine functions include making the hormones insulin and glucagon. These are really important hormones. So one of the jobs of the pancreas is to control blood glucose levels. It does produce insulin. Insulin is produced by the beta isolate cells. So if we look histologically, so if you look at a histological section of the pancreas, which is over here on the left-hand side, you will see there are cells that are involved in the exocrine function, but then there are these little isolates, these little packages or collections of specialized endocrine cells inside of the pancreas, and we call those the isolates of Langerhans, named after the scientist that first histologically identified them. And if we took an isolate and blew it up, we can see it over here on the right-hand side, that there are various kinds of cells here. So alpha cells secrete glucagon, and beta cells secrete insulin, and there's some other miscellaneous cells in there as well that secrete other kinds of things. We want to focus on the alpha and beta cells, though, in these isolates of Langerhans. So these beta isolate cells are going to produce insulin. They reduce the blood glucose level when that hormone goes into the bloodstream. Glucagon is going to be produced by the alpha isolate cells, and they're going to raise blood glucose levels. So these are antagonistic hormones. One raises blood glucose levels, one lowers blood glucose levels. So they work in conjunction to maintain homeostasis of your glucose levels. So insulin causes these effects in target cells. It increases it causes an increase in cellular uptake of glucose. Your cells have to be told to take in glucose, and insulin is the hormone that tells them to do that. It accelerates glucose use in the production of ATP, and it stimulates the formation of glycogen. Okay, so after you eat a big meal, you want nice large quantities of insulin to be secreted so you can uptake that glucose, utilize that glucose to make energy, and then if there's excess amounts of it, you can make glycogen and store it for later usage. Insulin also stimulates amino acid uptake by cells and also protein synthesis. And additionally, it stimulates fatty acid uptake by cells and then triglyceride formation. So insulin, really good after you eat. Glucagon is going to be is going to have some antagonistic effects. It's going to stimulate the breakdown of glucose and glycogen. So it stimulates the breakdown of the triglycerides. It will stimulate the production and release of glucose and what we call gluconeogenesis. That's a process that is going to produce and release glucose from the body. Okay, so antagonistic. So you want glucagon working when your blood sugar level gets super low. And this is just basically showing you the homeostasis, how it's created by the effects of glucagon. This graphic shows you how glucagon and insulin are going to be working to maintain glucose homeostasis. Excuse me. I believe that's the first time I've ever sneezed during a video. So there are disorders related to a dysfunction of the pancreas. Diabetes mellitus is one of them. It has many root causes to it, but what happens in diabetes mellitus is you're going to have glucose will accumulate in the blood, so it'll cause hyperglycemia, high sugar content in the blood, and it will cause glycosuria, which is a high glucose content in the urine. It causes excessive urination or polyuria. So there are two types of diabetes mellitus. We have type 1 diabetes, which is caused by inadequate insulin production. This is I think the lower amount of people. So somewhere around 5% of the people that have diabetes are going to have the diabetes, which is type 1 diabetes. So people with type 1 are going to require insulin injections, and a lot of these folks acquire this very early in their life when they're a juvenile. Type 2 diabetes is caused by cells becoming insulin resistant. The person may produce normal quantities of insulin, but their cells are not responding to it. And this is associated with obesity. And one of the cures of type 2 diabetes is to lower your weight and watch your diet. So we are seeing a great rise in diabetes, especially the type 2 diabetes. This is the one that you'll get if you ever get diabetes. If you don't have it already, this is probably the one that you'll acquire. There are some medications you can take, but controlling your diet, losing weight helps you to, and increasing exercise will help you to decrease the effects of type 2 diabetes. So the pineal gland is located inside of the brain, so it's located right behind the thalamus. And this particular gland produces melatonin. This is a hormone made at night. It stops the pineal gland stops its production during the daytime, and it controls what we call the circadian rhythm. So if you ever do east-west travel, where you go into different time zones, or shift work where you have night or day shifts, this can disrupt its production and not make you feel so good. Okay. Our next gland we want to discuss is the thymus. The thymus is located, right behind your sternum, so it's located in between your lungs, and it is inferior to the thyroid gland, and it's superficial to the trachea. It is located, like I said, between the lungs and behind the sternum. It produces these hormones called thymosins. These are hormones that promote the maturation of the immune system cells called T cells. So it is kind of like a school for T cells, and it helps to promote their production and education so that they don't destroy your body but destroy microorganisms that are invading in. So the kidneys are also, they have a function in the urinary system, but they do have an endocrine function as well. They produce several hormones. One of them is calcitriol, and calcitriol, which is the active form of vitamin D, stimulates calcium and phosphate ion absorption in the digestive tract. It stimulates bone reabsorption by osteoclasts, so it stimulates the bone destroying cells to release calcium into the bloodstream. Erythropoietin is a hormone also created by the kidneys. It stimulates the red bone marrow to produce red blood cells. So if you have low oxygen content in your bloodstream, the kidneys can sense that and then create erythropoietin to increase your red blood cell production. There are athletes who take a synthetic erythropoietin called Procrit, and they'll actually take that hormone so they can stimulate red blood cell production and cheat in their whatever activity that they're doing. So there are tests to test for that synthetic hormone, and a lot of people get stripped of their Olympic medals because they're caught taking that synthetic erythropoietin. Renin is going to convert. It's going to be an enzyme that's produced by the kidneys that will convert several products in your bloodstream into active hormones. So it converts angiotensinogen, which is an inactive protein, into angiotensin 1. And now we can come back to this graphic and kind of complete that. So if you find yourself dehydrated and sodium is deficient, or you've been stabbed and you've lost a lot of blood, so this will decrease your blood volume. So loss of sodium and dehydration and hemorrhage all will decrease your blood volume. This decrease in blood volume will decrease your blood pressure. We have sensors in the kidney that can sense a decrease in blood pressure, and they will increase the production of this enzyme called renin. Renin will take a pre-hormone called angiotensinogen, and it's made by the liver, and it will cleave it and make it into an active form called angiotensin 1. Angiotensin 1 will go to the lungs, and in the lungs there are angiotensin converting enzymes called ACE enzymes that convert angiotensin 1 into angiotensin 2. Okay, angiotensin 2 is going to do several things. It'll increase the production of aldosterone, and it'll also cause vasoconstriction, or a narrowing of your arterioles, which will increase your blood pressure. Okay, what aldosterone does, as we mentioned before, will help you to increase your reabsorption of sodium and water back into the body. All of these things will increase your blood volume. If your blood volume increases and your blood pressure increases, this will go back and shut down. Actually, it'll go back and shut down the production of renin. Okay, so if you have too much angiotensin 2, that can be a problem because it can cause high blood pressure. So if you have too much of that hormone, we have ACE inhibiting drugs. It inhibits this enzyme, so therefore it inhibits the production of angiotensin 2. Thus, it lowers your blood pressure. So maybe one day you'll have high blood pressure, and they'll treat it by giving you an ACE-inhibiting drug. Your testes and ovaries are also endocrine glands as well. And the gonads, or the ovaries and testes, not only do they produce gametes, which are in females oocytes and males sperm, but they also produce various hormones. So estrogen, there's two different kinds, estradiol and estrone. These are produced by the ovaries. So is progesterone, relaxin, which relaxes the symphysis pubis during childbirth so that you can have a larger birth canal. And inhibin actually goes back and shuts down the production of luteinizing hormone and follicle stimulating hormone. Testes also produce testosterone, which is kind of the male hormone, and inhibin as well, which will go back and shut down the production of FSH and LH. So your adipose tissue produces a hormone called leptin. Leptin acts on the hypothalamus to inhibit appetite. Leptin must be present for gonadotropin-releasing hormone to be made and released. So it actually has a function other than inhibiting appetite. It has a way to communicate to the testes and ovaries some things that are going on. Specifically in girls, though, thin girls, we know that this leptin production is important in regulating things like menstrual cycle. So thin girls typically will enter puberty late because if they're thin, they don't produce a lot of leptin, and if they don't produce a lot of leptin, then they don't produce the gonadotropin releasing hormone, which is going to tell the the pituitary gland to release follicle stimulating hormone and luteinizing hormone. Leptin, so we also see that increases in body fat can improve fertility because it increases the release of FSH and LH. And women stop menstruating when body fat becomes really, really super low. So if you get a really low body fat, leptin will stop being produced and it'll stop producing gonadotropin releasing hormone, thus stopping the release of follicle stimulating hormone, luteinizing hormone, which are important in producing a menstrual cycle. Oddly enough, the heart not only circulates blood through the body, but the cardiac muscle tissue will make and secrete natriuretic hormones when they're excessively stretched under high blood pressure situations. These hormones are going to promote the loss of sodium, promote the loss of water, which will decrease blood volume and therefore decrease blood pressure. They also inhibit renin. So if you inhibit renin, you inhibit the eventually the production of aldosterone. It also inhibits the release of antidiuretic hormone and suppresses your thirst. So that hormone has a lot of different cool functions that all together will lower blood volume and thus lower blood pressure. So it's always important that when we study different systems of the body that you understand that no system stands by itself, but every system has effects on every other system. So I encourage you to make sure you look at this graphic, print it out and look at it, and see how the endocrine system affects the integumentary, the lymphatic, the respiratory, digestive, reproductive, cardiovascular, nervous, muscular, skeletal. So all the systems are influenced by the endocrine system. Last thing I'll talk about is the stress response. So eustress is actually very, very helpful or useful stress. It's everyday stress that prepares us to meet the challenges of just everyday living. When we get to the point where we are stressed to the point of that it causes a harmful effect, we call that distress. Okay, and this could be very damaging to us. The fight or flight response is the first stage of the stress response, and it stimulates the body's resource to prepare for immediate activity. So your sympathetic nervous system and then epinephrine, norepinephrine, these are hormones that are released in the fight or flight response, and we have this every day. And it's normal, and it helps us, it helps us to survive. If we have lots of this fight or flight response activated all the time, though, it can cause distress in the body. So resistance reaction is the second stage in our stress response, and it lasts longer than the fight or flight response, and it occurs when we're under really super stressful situations and distressful situations. So just to orient you with this graphic here, we have the hypothalamus here at the top, and then we have the anterior pituitary over here. So during the stress response, we can increase the heart rate, increase constriction of blood vessels, thus increase our blood pressure. We can dilate blood vessels in places that are important for survival, like the muscle tissue. We can contract the spleen, which is a reservoir of blood, so that can increase the amount of blood in our bloodstream for our brain to work and for our muscles to work. We can convert glycogen in the liver into glucose, so we have sugar. We'll increase sweat to cool us down, dilate our airways so we can increase the amount of air coming into our body. We stop the digestion of food. We don't need to digest food in a stressful situation. And we retain water and elevate blood pressure. These are all things that can be done through epinephrine and norepinephrine, which of course comes from the adrenal medulla, which is stimulated by the sympathetic nervous system. So in longer term stress responses, we can have the production of cortisol. We can also have the production of thyroid hormones. These are going to increase, the use of glucose and produce ATP. In the long-term stress response, We can reduce inflammation. Maybe that's happened when we've broken an arm or done something that's very damaging to us. And so all of these things are regulated, of course, by stressors that stress the hypothalamus to release releasing hormones. You can see all these releasing hormones that are released. They cause the anterior pituitary to release various hormones so that we can get cortisol. This is growth hormone. It's releasing various growth hormone response hormones, and then thyroid stimulating hormone that releases the thyroid hormones. Cortisol is a very, very stressful hormone, and I just show you this graphic here to show you all the effects: high blood pressure, depression, decreased immune system, arthritis, hunger, hostility. So it has behavioral and physiological problems that it causes in long-term quantities to it. So it's really important not to have long-term stress, but to have some mechanism like yoga or meditation or exercise that can help you to stop producing cortisol in the body. Okay, well, that's a quick jump through the endocrine system. You can spend the rest of your life studying endocrine hormones. That's a very complex system, and that's probably why you don't even know an endocrinologist, a person that studies the endocrine system. These are rare people. They're a very hard discipline to tackle and figure out, but this is a very important system to understand the regulation of the human body. Well, we'll see you next time, and I hope you have a great night or morning or whenever you're watching this. I hope you have a great day.